Tunde, before you ask Achalugu to come sit on your face, ask her one particular question. Are you up to date with your cervical smear or your pap smear? The cervical smear can detect HPV virus, and there are some HPV viruses that has been linked to causing cervical and throat cancer. The HPV virus is also called the human papilloma virus. So if you're a giver of conlingos and you ask Atalugo to come sit on your face, whereas she hasn't been up to date with her cervical smear, and probably unfortunately Atalugo is carrying HPV, you could get HPV virus from that act, which could increase your risk of throat cancer. However, if she's up to date with her cervical smear and you're a non-smoker and you don't drink alcohol heavily, then your risk is just a bit low, especially if you don't have a family history of throat cancer as well. Now, for Achalugo, if you want to reduce your risk of having cervical cancer, you need to attend your cervical smear. What happens at your cervical smear? Your doctor or your nurse would basically take some sample of the neck of your womb. They send off the sample and they usually test two things. The first thing they test is for some virulent type of HPV viruses, and they also check the cells at the neck of your womb. So if it comes back clear, then you basically go back to routine recall. Cervical smear is usually done every 5 years between the age of 25 to 64 years. Before, it used to be every 3 years from the age of 25 to, I think, 50 years, but now things have changed. They've basically changed it to 5 yearly in the UK. If your test comes back positive for HPV, HPV is a virus which is usually self-limiting. So they expect that your body should fight the virus and you should be clear in no time. However, if they find any changes in the neck of your womb, then they will refer you to a gynecologist who will do a lower excision. They basically slice off the parts where the cells, where the pre-cancer cells are located, and they then do another smear test to confirm that you are clear. Allow me to reiterate that a pap smear wouldn't treat an existing cervical cancer. So if you're a lady watching me today, are you up to date with your cervical smear? Kindly let me know in the comment. Thank you so much for watching.